Hi friends, welcome to Smile Nursing tutorial. Today we are going to see how to write paturation register. See, in this year number, monthly number, then client details, obstetric history, admission details, next details of intervention for delivery, details of delivery, next information about baby, complications in case of referral, condition of mother and baby at discharge, next postpartum family planning. After that, follow up details. See, all these columns comes in paturation register. Now we will see one by one how to fill. Now first we will see the client details. In this we have to write registration number, that means IP number. For example 3824. RCH number. In this you can see the patient, mother and child card. Next name and age. For example K Radha, age 25 years. After that, husband's or father's guardian's name. Here we will write the husband name, wife of Kumar. Address, whatever the patient address is, here we have to write. For example, Nellore. Okay. Next, mobile number. We have to write here patient mobile number. After that, BPL, below poverty line. Next, if it is below poverty line, we have to tick it S. Next, patient Aadhaar number. Here we have to write. Here bank details. We have to get the details of the patient and write the bank details. Here Asha name and contact number. Sometimes along with the patient Asha will come. So we have to write the name of Asha and contact number. Obstetric history. In this we have to see LMP and EDD. You can see in the patient case sheet LMP and EDD we have to write here. Next, gravida. For example, if the Radha is G2, we have to write here. Next, parity P1. Abortions, whether the patient has any abortions, here we have to write. If she is not having anything, we have to write nil. Next, living children. If the patient is primary, she doesn't have any children, no need to write here. Next, here is gravida 2. So, para 1. She has one child. Here we have to write 1. Previous LSCS, yes or no. Whether she underwent cesarean section. If it is yes, we have to write yes. Otherwise, no. We have to tick it like this. Next, other previous complications. If she has any complications during delivery, we have to write here. Next, coming to the admission details. Here, date and time. For example, 10/9/22. Time at 10 a.m. we have to write it. Direct in labor, we have to tick it. Next, gestational age in weeks. Whether the patient is in 38 weeks, 40 weeks, whatever it is, we have to write. For example, 38 weeks. Next, BP 120/80, it is normal. Next, temperature 98.6 degree F. FHR 120 to 160 is the normal. So whatever it is, we have to write 140 per minute. Next, proteinuria. Now the patient is having nil, so we have to write here nil. HB, we have to write whatever the patient HB. Here it is 8.5 grams. Blood group B positive. HIV status negative. Next, syphilis negative. Malaria she doesn't have. Next, hepatitis B negative. hepatitis C negative. Okay, now here we have tried all those patient reports. Next, referred from. If the patient comes from any hospitals, we have to write here. Next, identified as high risk. If it is high risk, we have to tick it like this. Next, we have to specify if the patient is NAPAH, eclampsia. So here, if we know, we have to write clearly here. Next, details of interventions for delivery. Photograph field. Okay, everybody is doing this, so we have to tick it. Inducted, augmented, any inducted labor or augmented labor, if it is here, we have to tick it, otherwise no need. Dexamethasone, if the patient is preterm, if it is given, you have to tick it, otherwise no need. Injection magnesium sulphate. See, if the patient is NAPAH, if you might have given, that time you have to put it tick mark, otherwise like this you have to do. Episiotomy, for example, the patient is normal delivery, the patient is primary or multi, whatever it is, if you might have done any episiotomy, sutures done, here you have to put it like this tick mark. AMTSL, active management of third stage of labor. So this everybody is doing compulsory third stage of labor, put it tick mark S. Type of heterotonic drugs. Oxytocin IM, put it tick mark. Next, delayed cord clamping, 1 to 3 minutes, tick mark. Antibiotics, if you have any antibiotics given, put it tick mark. Blood transfusion, so during delivery time, if you have given any blood transfusion, okay, you can put it tick mark, otherwise like this you have to write. Next, coming to the details of delivery. Date and time. For example, when the patient come 10/9/22 at 10 a.m. So now she is delivered at 10/9/22 at 2 p.m. Normal delivery. Next, assisted delivery. For example, instrumental or vacuum, etc. If you might have done delivery by using this, you can make it tick mark. If it is cesarean, you have to make it tick mark here. If cesarean indication, refer to Robson group in case sheet. So, conducted by, who has conducted delivery, here you have to write the name. Mother, alive or maternal death. Baby, single, you put a tick mark here. Multiple, if it is any twins, you have to put a tick mark here. Term, so this is 38 weeks term. If it is preterm, you have to make it tick mark here. Next, baby is alive. Okay, if it is stillbirth, phrase, macerated, newborn death, so according to the baby condition, you have to put it tick marks here. Next, information about baby, identification data. Okay, in this sex, male baby or female baby. Now I have male baby, so I got put mark here. Next, others. Weight, 2.5 kgs weight. So you have to write the baby's weight here. Died immediately after birth? Yes. Resuscitation required? No. My patient does not require, that's why I kept no tick mark. Breastfed within 1 hour? Yes. If not, mention time. If any problems, the baby has any complications like that, so that time if you are not giving breastfeeding, you have to mention the cause. Next, vitamin K1 given, yes. Vaccination done, so BCG, OPV, hepatitis B, whatever you give, you have to put it tick mark. Okay, next, coming to the complications. Next, in these complications, if the patient has any APH, antepartum hemorrhage, you have to put a tick mark here. PPH, here you have to tick it. Pre-eclampsia, eclampsia, sepsis, obstructive labor, prolonged labor and others. Whatever it is, so according to the patient condition, we have to put it tick mark here. Next, coming to the baby. If baby has any sepsis, asphyxia, low birth weight, prematurity and others. So according to the baby condition, we have to put it tick mark here. Next, coming to the in case of referral. Now if you want to refer the mother or baby, so you have to write the region, mother region. In which region you are sending the patient to the referral, so you have to write the region here. Next, refer to, where you are referring, so referring to suppose RIMS Kadapa, so like that you have to write baby region referred, where you are referring, for example RIMS Kadapa. Okay. Next, maybe you can write the region, baby region maybe low birth weight. Okay, now we are referring to the RIMS Kadapa. Mother region maybe PPH, so now you can refer to the RIMS Kadapa. So for example, just I told you like that you have to write. Next, condition of the mother and baby at discharge, date and time of discharge. Here it is 10/9/22, so the patient is getting discharging 12/9/22 at 2 p.m. Like this you have to write. Mother BP at the time of discharge 120/80, temperature 98.6 TF, bleeding per vagina normal. Like that baby also you have to write temperature 98.6 degree F, feeding breastfeeding, respiratory rate 40 per minute. Next, postpartum family planning. Counseling, if you might have done counseling, yes. If you might have given, you can tick it, put mark yes. Method chosen, whether they might have taken LAM or condoms, injectable, PPIUCD, male sterilization, PPS and others. So whatever the postpartum period, you might have given family planning, whatever the patient has chosen, how to tick it here. So my patient has taken PPIUCD, so I kept tick mark here. Next, date of method adopted. So when she has taken the PPIUCD, so my patient has taken 11/9/22. Due date for follow-up. Here we have to write the due date. Now I am writing 1 week, so 17/9/22. Here additional info or follow-up details. Okay. Next, here signature of labor room in charge. So whoever having in charge of labor room, they have to sign here. Okay. Today we have discussed about the parturition details. Thank you for watching this video. If you like, share, subscribe and comments.